My name is Prabhakaran. I'm a cardiologist and an epidemiologist, and I head the Center of Excellence at the Public Health Foundation of India, which is a center functioning in collaboration with Emory University, All India Institute of Medical Sciences, Madras Diabetes Research Foundation, and Aga Khan University, Karachi. Chronic diseases are a huge burden in India. The reason why it's a huge burden is because the numbers are huge to begin with, and second, it afflicts Indians at a much younger age as compared to their Western counterparts. The disease starts almost 10 years earlier amongst Indians as compared to the Western counterparts. All this translates into huge economic losses to individuals. Just to give an example, the WHO estimated that India lost $5 billion in the year 2005, and they estimate India would lose cumulatively $237 billion by the year 2050. And if you put it in perspective, $237 billion is almost nearing 20% of the current GDP of India. Our center plans to do a range of researches, but the main ones are to keep account on the numbers of what happens with regard to heart disease and diabetes. We would like to do this through a program called surveillance program, which essentially means to constantly evaluate what exactly is happening in terms of the heart disease burden, to find out how many people are having heart diseases, what happens when they have heart diseases, do they approach a hospital, do they go to a hospital, do they get treated properly. The next part of our research is what we call as translational research. You know, the treatment for diabetes or heart disease is very simple. All we need to do once patients develop diabetes or heart disease is to give simple treatments, simple drugs, changes in diet, changes in lifestyle, improve physical activity, but none of these are emphasized to a large proportion of patients, because of which patients go on to develop complications. We therefore intend to do what is called as translation or implementation research by providing non-physician healthcare providers in diabetic clinics and evaluating them against usual care. In addition, we are also harnessing the technology, the information technology, by developing a decision support system which the care coordinator will use and assist the physician in controlling the complications of diabetes. Our research will help people in India in multiple ways. One, it's going to feed into policy. It will help policy development in terms of prevention. For example, we know that smoking is a major cause, and if we identify the populations in which smoking is highly prevalent, so we could target them in terms of and implement the policies of tobacco control, such as pictorial warnings, raising taxes, or even having shops that sell tobacco in that particular area to the bare minimum. So those are the kind of things that one could do once we know what exactly the problems are. The second research project that I spoke about is what we call as health systems research, where we are intervening in diabetic clinics to improve outcomes. And once we demonstrate that it's useful to have care coordinators whom we are going to train and develop a totally new cadre, we can upscale this program to be used all over India and also in other diseases. Why not? Our training has multiple components. We are training postdoctoral fellows into learning research methods, into learning how to do prevention. We are also training junior faculty in terms of writing grants for developing prevention programs. And we're also conducting yearly programs called Research Methods Training Program for a whole range of people. And this is a 4 to 5 days program. There are multiple things I would like to achieve for our center and India. In terms of center, we would be very gratified if we are able to train 75 to 100 young people who are passionate about research, who are passionate about prevention, and would go out and work in terms of preventing or reducing the cardiovascular disease burden in India. This 100 appears a very small number, but we would reach a critical mass with numbers like 100 or 200, because currently we have very few passionate researchers in the field of chronic diseases. In terms of India, I think even if we reduce the burden of chronic diseases by 1% over the next 5 years, we would have done a huge job.